The first thing we do when we walk in that hospital is go straight to get our IV started. And Karina's there to take care of us.
Primero te vamos a hacer IV ozone, que es oxígeno intravenoso. Después te vamos a poner un suero que se llama Myers Cocktail, que esas son puras vitaminas.
Before we put tens of millions of stem cells into a patient's bloodstream, we want to remove anything that could counteract those. So IV ozone is what it's called, and it actually kills any parasites, pathogens, bacteria, or viruses that are in the blood. And again, we're hyperoxygenating the body. The more oxygen, the better.
Getting hooked up with these IVs, Myers, ozone, NAD, these are all great for the stem cells.
The Myers cocktail is really just a vitamin IV cocktail. Everything that we make in our Myers cocktail is made fresh in our compound pharmacy, so you're getting fresh IVs. We use NAD Plus for cellular repair. It increases ATP. It's great for the mitochondria, and we use it in a synergistic way with a lot of our other treatments. We also have hyperbaric oxygen, which patients do generally after their stem cell therapy. They actually do it multiple days, but oxygen is pushed through the body basically as a patient is in the chamber. We have a big chamber, a 6-person chamber. The patient wears an oxygen mask. The chamber pressurizes, pushing oxygen to parts of the bodies that may not get it. And this is great for injuries. This is great for stem cells as well, because it's really circulating those stem cells even better through the body.
And there's even studies out now that show by combining our mesenchymal stem cells intravenously with hyperbaric oxygen can actually lengthen the cells, the DNA's telomeres. So the longer your telomeres are, the younger your cells are at.
About to jump in this room and do some PEMF on my joints, in particular my knees and my shoulders.
No chains, no rings, no phone, anything that's electric or electromagnetic.
I love PEMF therapy. It's basically a magnetic pulse that gets fired into the cell. And what that does is two things. It brings dying cells back to life. It's really good for an old injury that somebody has had for a long time, because it kind of kicks the healing response of the body back in on that area. The other thing that it does is it actually vibrates your cells at the exact same frequency that your body does as it's replicating cells.
I'm putting it like right in my lower back. It feels like I'm just getting like shocked almost.
We're creating a healing response in the body. So if I have a bad knee, I'm telling the body, hey, heal right now in the knee. So we find that makes it more effective, and it makes the stem cells kind of go more to that area to give increased healing to the patient. And we use that both before we give the stem cells and after we give the stem cells.